Hey there and welcome. I'm Anna Hartman and this is Unreal Results, a podcast where I help you get better outcomes and gain the confidence that you can help anyone, even the most complex cases. Join me as I teach about the influence of the visceral organs and the nervous system on movement, pain, and injuries, all while shifting the paradigm of what whole body assessment and treatment really looks like. I'm glad you're here. Let's dive in. Hello. Welcome back to the Unreal Results podcast. So funny thing, I'm recording this podcast a second time today. Even though, what happened? I'm in desperate need of a new computer. My computer, I got it in I think 2017, so it's hitting that 6-year mark. 5 or 6 years is about how long the old laptop lasts for, and running out of RAM. It's going real slow. Can only have like 1 or 2 programs open at a time. Run out of space. All the things. So what happened was I recorded this whole podcast, and then at the end it said error. Can't save podcast, file lost. And I was like, and so I have this little clean my Mac thing. So I cleaned it. I made more space. And then when it was done cleaning, it automatically opened everything back up. And it was like, oh, here's your recovered file. So technically, I have the file, the video and the audio that I recorded. But I have this thing. When something gets deleted like that, I feel like it's the universe telling me it wasn't that great. Maybe you could do a better job. So, you know what? I was like, screw it. I do feel like I could do a better job, because even though I wrote down my thoughts to try to keep them all organized, I was still all over the place. And so I want to give it a second round. And if you're hearing this, the second round was better. If you're not hearing this, you won't hear this. So anyways, here we are. It is March. I'm recording this on March 21st. It's Tuesday. It happens to be the day after the spring equinox. You would never know that in California because it's been raining all day, heavily, thunderstorm, rain. Without even knowing really what the weather was supposed to be like when I was laying in bed today, I knew it from hearing the airplanes take off. I live on the flight path right by the San Diego airport. And usually I'm on the side of the airport that it's usually planes landing. So it's quiet. I don't often hear planes. But if you've ever flown in and out of San Diego, you know when there's wind and rain and weather, it often turns the airport around. And instead of landing going west, you land going east from the west, and then you take off to the east. And so when you take off to the east, you take off over my house, and it's super loud. And as soon as the airport opens up, if a plane wakes me up, I could grab my phone and know what time it is. So yeah, it's a weathery day. This second day or first day of spring. I don't know what you consider it. Is the day after the equinox the first day, or is the equinox the first day? Half full, half empty? I don't know. Tomato. Not really sure the semantics of it. Either way, it's definitely not looking like springtime here in sunny Southern California, but I know it's springtime, not just because it was the equinox yesterday, but because of what complaints my athletes and clients are having lately. That might sound funny to you, but about a week or two after Groundhog Day, I made a comment to one of my athletes, and I was like, hey, I don't need the groundhog. I don't need the groundhog to let me know if spring's coming or not. Because I know spring's coming, because I'm starting to see very springish visceral referral patterns with people's aches and pains. And so maybe you're new to it, maybe you're not. This a lot of some of the understanding of patterns that we see in the viscera, both from a functional and a emotional standpoint, that is part of the visceral manipulation education, is from traditional Chinese medicine. And traditional Chinese medicine, each organ or each season, there's actually more than 4 seasons in traditional Chinese medicine, but regardless, each season is associated with certain organ. And the spring is associated with the liver and the gallbladder. The spring is inherently a time of new energy, cleansing, like a rebirthing sort of, right? Makes sense. What we see in nature, right? In the spring is a coming out of hibernation, coming out of the darkness and the dampness and the wetness of winter, and into the more fresh, sunny, like energy of spring. And so this load on the liver and the gallbladder can affect our body, and affect our emotions, and affect a lot. And so that is exactly what I see. And part of it is actually, I think, a response of our immune system, specifically our immune system related to some typical like triggers of hay fever and our immune and allergy response, right? So oftentimes people don't really think about it, allergies and hay fever, as being an immune response, but that is exactly what it is. And so we have this, like, theoretically we've been in the, like I said, the dampness and the wetness of winter, and that can be kind of associated with like a lot of molds and those type of mycotoxins. And then as the spring happens, and the sun comes out and the breeze comes, and like those sort of get a little moved around, as well as the plants start coming up and the flowers start blooming, and so the pollen starts getting greater and that kind of thing. And so it's just a time for seasonal hay fever and allergies. So allergies have a big load on the right, specifically the right bronchus, the liver, and the right kidney. And so a lot of what I'm seeing from my clients is aches and pains or movement dysfunctions related to the common referral sites, right? The musculoskeletal areas of the body that these visceral organs refer to. So, if you haven't already downloaded, I have a free download for everyone who listens to the podcast. You can go to unrealresultspod.com and download the free Visceral Referral Cheat Sheet. And you can see some of these common referral parts. Now, they're common, so they're kind of generalized. They're not specific to the person in front of you, but the common generalized referrals for the right lung would be the right, like, upper back, the right neck, the right shoulder or upper extremity. The common visceral referral for the liver is right shoulder, right neck, mid back, and upper back. The common referral for the other one for the liver is left sciatica. And then also the kidney, the right kidney, common is low back, front of the hip, and knee and adductor. So those are sort of the general referrals. Now, knowing that's super helpful, and just like it says on the Visceral Referral Cheat Sheet, it can be super powerful in understanding that if your patient comes with those, like, maybe you should look at these organs and do things around this organ. You don't have to be trained in visceral manipulation to have an effect on these organs. But, it's just more with directed exercise, which I'll talk a little bit about in this episode. However, it's important to know where the patient's visceral referral is coming from, or visceral restriction, visceral pattern, or nervous system pattern is coming from. And I evaluate that in 2 ways. I use my general listening techniques that I learned through the Burrell Institute, but I also confirm that with some more solid, like tried and true orthopedic type tests. And that is what the LTAP is. So the LTAP, the MovementREV LTAP, it's an acronym for Locator Test Assessment Protocol. And it's a series of 5 like orthopedic-based tests that help to direct me exactly where the body is protecting in the viscera or the central nervous system or the peripheral nervous system that is relating to the person's aches and pains or movement dysfunction. So that's what I mean by my patients are coming in and I'm finding these. Is not that I'm just finding the common referral sites, but that my locator test assessment protocol is directing me kind of constantly since, for about a month now, to the right lung, to the liver, to the right kidney. And I'm seeing a lot of the common associated musculoskeletal complaints too. So specifically for today, I want to talk mostly about the liver because the liver ends up being something that comes up kind of all year long, but is really powerful, but definitely a lot of this time of year. So I just want to share a little bit about the liver. The liver is our largest digestive gland. It's an exocrine gland. It's a large organ. It weighs about, what does it say? I wrote it down, 2 kilograms. So 4.4 pounds. That's a heavy organ. We don't necessarily feel all that weight from the organ because of the intrathoracic pressure. It sort of helps to hold it up, but still, it's a heavy organ. The organ, it is like, tucked underneath your rib cage on the right side. It goes up to about like rib 6, rib 5, and then all the way across to the left side, about mid clavicle line on the left side. I like to think of it as football shaped, but it's a little bit, of a wonky football. But that's kind of a good image anyways. The majority of the direct diaphragm connection to the liver is actually on the posterior side of the liver. The posterior side of the liver is not as big as the anterior side of the liver. The diaphragm connects posteriorly with the liver in the area called the Barrett area, and it also has a joint capsule there called Glisson's capsule. And that capsule is actually I always kind of think about it as it like provides some suction and lift to the area too. So it's an important part of the support of the liver along with the coronary ligaments. The coronary ligament turns into the triangular ligament and the right and left side and attaches to the diaphragm. So that's our main like support system of the diaphragm. The other main ligament, called the falciform ligament, is sort of that one that goes between the lobes. It attaches also to the diaphragm and then the anterior abdominal wall, anterior abdominal wall. The liver is mainly responsible for our energy, like regulating our energy and our metabolism. So it's actually one of the only organs, except for the kidney, that is directly related to our energy. So if you have a patient that's really just talking about how tired they are, it's important to look at the liver. And it also optimizes our blood flow, lymphatic flow, bile fluid flow. So it's really important organ for like maintaining our fluid balance in throughout the body, really. This is why the liver is an important piece of my swelling reduction protocol. So I did a podcast on that. It was like one of the first podcasts I did, called the MovementREV Swelling Reduction Protocol. So I'll make sure to link that in the show notes. But that plays a big role. The liver plays a big role in fluid balance. And we're going to talk about that and how it relates to one of the common things, musculoskeletal things that I see quite a bit. But I also wanted to share about the diaphragm, or about the diaphragm and the liver. Just when we think of the liver, I talk a lot about how organs need to move. The mobility and the motility too of the liver, the movement that the liver is involved with, basically mimics the movement of the diaphragm. And this makes sense since the diaphragm's right there. I always tell people that's like the liver and the diaphragm make a joint with each other. But if you think about the shape of the diaphragm and what happens, especially when you think about the attachment from the falciform ligament and the triangular ligaments of the diaphragm and the liver, then you start to see where the motions of the liver go. These motions of the liver, they are not necessarily only connected to when we're breathing. These are like also cellular motions that the cells within the liver are going through. When I explain it, this is called motility. When I explain it to my clients, I basically, to like, I don't want to say dumb it down, but to make it like easy to understand, I'm like, it's like every organ has its own little heart rate, and it is constantly sort of ebbing and flowing, right? It's like a very like energetically alive thing. And this also mimics the migration of the cells that formed the organ from the midline of the cell in embryology. But in general, the directions of movement that need to be available at the liver are rotation. Rotation is one that I've talked about a lot with that swelling reduction protocol, because the axis of rotation of the liver is actually around the vena cava. So it's just sort of next to the spine, but just off to the side slightly. And so the liver rotates internal and external rotation around that axis. So that's like also one of the attachment points. There's this thickening ligament that sort of crosses over the vein there and makes a little sort of groove and allows the liver to rotate. So internal external rotation are a big important component of liver mobility. Then you have our flexion and extension component, but in the liver, the joint between the liver and the diaphragm, what we call that is an anterior roll and a posterior roll. So that anterior roll and the posterior roll, again, if you think about it making a joint, it's sort of like that flexion and extension, but right at the level of the liver. And then the final, that motion is dictated by the falciform ligament and then the diaphragm itself. And especially when you think about the breath pattern there, what happens, right? When the diaphragm descends and everything sort of drops down, you could see how that easily creates an anterior roll on the liver. And then as you exhale and the diaphragm ascends back or domes up, then the posterior side gets pulled down on a posterior roll. Again, these can be coupled with the breath motion, or they can be uncoupled movements with the breath too. But the directions of movement mimic the same directions the diaphragm goes through. And then the final one is sort of this like side bending motion. You can think of the side bending motion being fulcrumed from the left triangular ligament, and it acts like a swing. The whole big part, the right side of the liver, swings up towards the armpit and then down towards the pelvis. So it's this big swinging motion, much like the pump handle action of the ribs. So really, especially connected to that on the right side, where it's the bigger side of the liver. The left side of the liver, the left lobe is much smaller, and it doesn't go all the way over to the ribs on the, like to the side of the ribs or the side of the thorax on the left. So those are the motions whenever I'm looking at mobility of the liver that I'm trying to restore. Internal and external rotation, anterior and posterior roll, and then superior glide and inferior glide with the fulcrum over on the left side. So the other, what happens too is when the function, especially what we're probably seeing now in spring, as the load on the liver increases and the function starts to sort of diminish, then oftentimes that liver can get like a little like stagnant in it's just like the movement, the amplitude of the movement can go from really big to like it gets kind of stuck and small. And then when the organ's not moving, the body knows that that's not good. And so then it goes and protects the liver. And what happens is it uses the diaphragm to splint it. So the diaphragm then is not moving very well because it's in this protective pattern around the liver. And then this is like a cascade of events. It's like a pain cycle, right? It's like liver's not moving, diaphragm stiffens up to protect it, but then liver stops moving even more because now the diaphragm's not going through its full range of motion and like, I don't want to say forcing that mobility, but facilitating that mobility. And then our fluid system gets even more congested because we don't have that diaphragmatic pump helping us out either. And then when we have more congestion in our body, our liver gets even more overloaded, and it can be this like nasty cycle of like dysfunction. So in order to get the liver function and movement better, we can do some directed manual therapy treatment for it. But before we talk about that, I want to talk about one of the other relationships. So along with this congestion, decreased sort of like venous return and just stagnation of fluid is this relationship with the portal vein. So the portal vein is one of the main veins going from the liver to the spleen to the intestines, like the upper part of the digestive organs, as well as it also has a branch that goes down to like the sigmoid colon area and follows sort of the same kind of path. You can think about the two branches being like the superior mesenteric artery and the inferior mesenteric artery. The portal vein has those branches as well. And because of its relationship to the spleen and the liver, it's really that portal vein is really important for our fluid balance and our immune function. That's why it goes to so much of the gut, right? Our immune function is really related to our gut health. But so what happens when fluid gets stagnant and we get congested, that portal vein can get a little like bloated almost and cause a mechanical irritation to the lumbar and sacral plexus right there along the posterior abdominal wall and in the pelvis. And so that's how you start to get left sciatica pain. Along with this left sciatica pain from the liver, you can also sometimes experience some constipation because of this connection of the liver portal vein to the sigmoid colon area. So it's something to sort of be aware of. So another part of this stagnation pattern too, especially for people who menstruate, are around ovulation, our tendency to have some fluid congestion increases because of the hormones, some of the hormones that are released. And this can be another heavy load on the liver. And so if you're suspecting this, like I actually myself, I am like this, like around ovulation, I tend to get really bloated. Whereas some people that menstruate, they don't get bloated until actual menstruation week. This is a little bit different pattern, and is a little bit more related to like a liver overactive. And I don't want to say overactive, it's like probably underactive, like a too loaded liver. And so sometimes treating someone right before they ovulate can really help with this fluid balance that's associated with that kind of congestion too. So, or it can be the answer of why like maybe somebody has sciatica around the time of their menstrual cycle that they're ovulating, but then not really around the other times, right? Or maybe it's around ovulation and during the luteal phase, but during the follicular phase of the menstrual cycle, like maybe they feel great. So this, again, like having more knowledge like this helps to make sense sometimes of people's subjective history. So, how would we treat it then? So if someone's coming in with this left-sided sciatica or even right shoulder and neck pain, or even limited mobility on the right hip into flexion, and also with some like tightness and a prone knee bend, I would look to support the liver and do treatment around the liver. And a great way to do that is via the visceral somatic reflexes. So the level of the spine that is going to relate to function of the liver is T7, 8, 9. So those three thoracic segments, T7, 8, and 9, those are the segments that provide sympathetic information to that organ in the area around that organ. And so we can first, if someone comes in with these symptoms and my LTAP directs me to the liver, before I even do stuff right at the liver, I'm going to actually go check their spine and see if there's any sort of facet restrictions at those, specifically those segments, but I'm only going to look at those segments, and then I'm going to look in the cervical spine too, because since the phrenic nerve is one of the main sensory nerves for the liver, we can get a reflexive issue up at the neck at C3, 4, and 5. Typically, it's with the liver, it's mostly C4 and 5, but it can be any of those three or just one of them. So C4 is probably the most common, and then 5 and 3, it comes up as well. But so those are some common sites that we can see facet restrictions. Or even, let's say we looked at the spine and the spine's moving great in those segments, we can actually do treatment at those segments, whether it be skin stimulation or cupping or segmental flexion through that part of the body or whatever, just like a general PA joint mob or rotational joint mob. We can use that as a fulcrum point for our directed breathing exercises, whatever it may be. If we direct our treatment to T7, 8, and 9, or C3, 4, and 5, we're going to have a reflexive effect on the liver. And then when we go to do some of maybe these exercises, these movements to facilitate all of the directions of movements in the liver, it might be easier, right? So I'm all about not forcing the body, going back a step and figuring out a way to influence the organ without having to force it somewhere. So that's the first thing I would do, is check those segments and do some treatment around that area. And then you can recheck ranges of motion. Maybe knowing the patterns of movement that has to be around the liver, we might want to check thoracic rotation, right to left. We might want to check side bending, right to left. And we might want to check how well someone articulates through flexion and extension through the area, definitely through T7, 8, and 9, but really through that whole area between like T rib 5 and rib 10, right? The whole mass of the liver we want to see is the liver going in that anterior and posterior roll. So after treating the spinal segments, then I'm going to treat more of the liver. So like I said, with the movement, or I love to use the silicone, right? The flexible cups and like cup around that whole area. That can be really good. The way I'm cupping is I'm making sure I'm doing a skin lift, because what I'm looking for is the skin lift to have a reflexive effect on everything underneath that area, using the Hilton's law principle, which is that the nerves that innervate the skin those sensory nerve endings are the same nerves or from the same part of the nerves that innervate the joints below it. So if we're thinking about the intercostals and the diaphragm and the diaphragm liver joint and the costovertebral joints being a huge part of how allowing the liver to be able to move, copying that area or doing skin lift techniques around that area is going to be really helpful. So the other thing is going to be breathing exercises. And why I don't love starting there is because what I said in the beginning, right? When an organ is not functioning well, the diaphragm is actually going to go into a splint, like it's going to splint the organ, right? It's going to be tight. It's not going to want to go into a concentric or eccentric muscle contraction. And so the diaphragm can appear to be really tight. It might be hard for people to take a deep breath. It might, no matter how much you cue them, they might be doing like accessory breathing or like excessive belly breathing. And that is because of that splinting mechanism. So we want to give a little bit of information into the liver and get the liver moving a little bit first and then do breathing exercises. My favorite breathing exercise to do specifically for the liver is Da Vinci breathing. It's a Da Vinci roll with a breath. I learned it from Philip Beach. He wrote the book Muscles and Meridians. It is one of my favorite things because, one, you get a great stretch on the diaphragm because you're doing breathing in rotation. Whenever we're adding rotation into a big muscle and then doing something to it, we tend to be able to stretch it out more. Plus, we're mobilizing the liver because remember the internal external rotation around the vena cava facilitates liver mobility as well. I actually created a whole regen session focused on, I think it's the swelling regen session that does a lot of this focused breathing around the vena cava and the rotational pattern. So the interesting thing about that is most of our fluid organs live on that thoracolumbar junction because rotation is a really important movement that facilitates fluid flow and fluid balance in our body. So I mentioned that in the swelling reduction protocol podcast as well. So definitely make sure you check the show notes. But I think that's really the bulk of what I wanted to share today is don't be surprised if you have a rash of people coming in with left sciatica, right hip or knee issues, or just lack of mobility in those areas, even like lack of, quote unquote, glute activation, if you still use that term. I hate it. I don't use it, but you might still be, and that's okay. And then right shoulder and neck pain, or even mid-back pain. And if that's the case, if you're seeing those springtime patterns, maybe look to do some stuff around the liver I suggested and see how it goes. But hopefully this was helpful. I will link all the things in the show notes. The link to the podcast about swelling, the Da Vinci rolling from Philip Beach. I'll probably link his book too because it's amazing. And then what else did I mention? Oh, the regen session, also associated with the sort of liver breathing kind of things. And then, like I said, if you haven't already downloaded the Visceral Referral Cheat Sheet, do that. The last thing, I did mention the LTAP, and I don't know if I mentioned while I was talking about it. I don't think so. The LTAP Level 1 online course starts on Monday. So the doors are open until Sunday, March 26th. So depending on when you listen to this, hopefully you are interested and join. Jump in. It's a 6-week online course. It is my signature course. I offer it twice a year. So if you miss this round, make sure you jump on the wait list for next time. And this is going to be teaching you the assessment tools to figure out exactly where your athletes, where your clients, where their body is protecting the viscera. Then you have a better idea how to treat it. So like I said, this time of spring could be liver, also could be lung, also could be kidney. And 2, it doesn't have to stick with the spring things. It could actually be from somewhere else. The cheat sheet helps, but it's not the end all be all because it's not reading the patient in front of you. And that's what it's all about. So thank you for joining me. I'll see you next week. P.S. Version 2 was much better. So the universe was right. I needed to delete that recording and just start again. See you next time.